Welcome. This video is part of a series developed to increase awareness and use of quality improvement across the health unit. In this video, we'll focus on our partners and suppliers. A strategic approach to quality means doing work in each of the 6 drivers of organizational excellence identified in the Excellence Canada framework. Partners and suppliers is one of those drivers. By the end of this video, you should know what the driver related to partners and suppliers includes, why it is important to organizational quality, and what we've done here at the Northwestern Health Unit in this area. Partners and suppliers looks at our external relationships with other agencies and/or the alliances that are critical to meet our strategic objectives. It includes things like having methods in place to choose appropriate partners and suppliers, establishing and maintaining good relationships with them, communicating and sharing information, and measuring and reviewing the effectiveness of our external relationships. Working well with our partners and suppliers allows us to improve customer service in a couple of ways. First, by working with others, we can expand our capacity. Partnerships allow us to do more work and work that we would not be able to do alone. Second, working with partners to improve the service delivery system results in better customer service. For example, when we know what services other agencies provide or have referral protocols in place, it's easier for clients to move between agencies and get the services they need. And third, good external relationships reduce costs, either in time or in the actual dollars we pay for supplies and services. This means lower overall costs for the health unit, allowing us to do more with the resources that we have available. So what have we done here in the area of partners and suppliers? Well, we work with many partners to expand the reach and effectiveness of public health services in Northwestern Ontario. We work with partners both one-to-one and as members of coalitions to improve access to services, to improve the overall customer experience, and to increase the number of services available to people. Think of the many one-to-one relationships that we have with healthcare providers, schools, municipalities, or social service agencies, where we jointly plan and provide services to the public. We're also members, sometimes leaders, on many networks and coalitions across the region to increase the level of and/or coordinate service delivery. These partnerships are an intentional way that we do our work. They're mentioned in our strategic plan, and every program identifies the partnerships they need to carry out their work and achieve their objectives as part of the program planning process. Most of our partnerships are ongoing and informal, but where it's useful, we do formalize these relationships and develop policies or protocols. For example, in some programs, we have written referral arrangements to ensure that clients get the services they need as quickly and as easily as possible. Another example of a written protocol is the mutual aid agreement we have with Thunder Bay District Health Unit for emergency response. The finance team maintains ongoing relationships with our suppliers. We have an approved or regular vendors list. Our procurement, purchasing, and sponsorship policies and procedures provide guidelines for how we choose our suppliers and partners. Our choices are partly determined by cost, but also take into consideration things like philosophical compatibility, our past working relationships, dependability, and an understanding of Northwestern Ontario. Finally, we evaluate our partnerships, including our financial ones. In fact, evaluating external partnerships is one of the objectives in the strategic plan. The financial ones are perhaps easier to see, like our recent evaluation of shipping costs in companies, or the switch in banks that we just did that was based on the overall service package that best met our needs. We also evaluate our program partnerships, but perhaps more informally. Each year when people do their program planning, part of that process includes revisiting the number and type of partnerships that we need. And we maintain a list of external networks and coalitions so that we can know what external linkages we have, where our energy is going, and where we might be missing some important linkages. Next time, we'll look at the area of customer experience.